1.
Embryonic stem cells can basically be used to save thousands of lives. These stem cells should be used because they can help various diseases. First, I will tell you why using embryonic stem cells is a controversial issue. Second, I will talk about what other types of stem cells can be used. Lastly, I will say why embryonic stem cells are the most beneficial to use. Using embryonic stem cells is a controversial issue. According to Patrick Dobson, a writer for the National Catholic Reporter, this is because some think that when the egg is fertilized, it's human, but others argue that it is after birth. Hutchinson Unabridged Encyclopedia says that it is due to the fact that the embryo is destroyed in order to extract the needed stem cells. Dr. William Holbut, a member of the President's Council of Bioethics at Stanford University, does not agree on using embryonic stem cells because it is destroying life that has a soul. Dobson further states that, whether produced sexually by unison of egg and sperm, of asexually in somatic cell nuclear transfer, the cluster of cells that arises is human. As stated before, the whole issue is creating new life and killing it for the stem cells. The embryos that are used for research are about 15 to 16 days old when the cells are extracted. Stem cells have 3 general characteristics. They can divide and renew themselves for long periods of time, are unspecialized, and can give rise to special cells. Susan Carolyn, a writer for Palm Beach Daily News, said that some of the embryos used have been frozen in vitro fertilization and then donated for medical research. Embryonic stem cells are pluripotent, which means that they can turn into any cell needed or stay a stem cell. Being able to turn into basically any cell is why they should be utilized in research. Embryonic stem cells are not the only type of cells that can be used. There are adult stem cells which are found in mature tissues. The issue is that adult stem cells are limited. They were thought to only be able to turn into the type of cell where they originated from. Research has shown otherwise. It is now known that stem cells are able to transdifferentiate. Transdifferentiation is when stem cells can turn into cells different than when they originated from. For example, blood cells turning into muscle cells is an example of transdifferentiation. It is difficult to get the adult stem cells to transdifferentiate. A writer for the Health Reference Center said that adult stem cells are hard to identify, make more of, and maintain. Therefore, embryonic stem cells should be used because they are easier to retrieve and more likely to work. Using stem cells can be beneficial to many people in various ways. According to Joseph Pano, a writer for Science Online, they can be used to cure cancer, spinal cord injuries, neurological diseases, and repair damaged organs. Stem cells may also be used to grow organs that are needed. Being able to grow organs would be extremely beneficial because it takes a very long time to get an organ. There is also less of a chance that the organ will be rejected. Rejection occurs because the immune system flags the cells and they are destroyed by other cells of the body. Being able to use stem cells for this will help out many people. Pano further states that stem cells were injected into rats with brain damage and most of the damage was fixed. The mice had lost the ability to move some of their limbs, and after the stem cells were injected, then they were getting some of their motor abilities back. Using stem cells can also help those who suffer from type 1 diabetes. Type 1 diabetes is where the cells of the pancreas that produce insulin are getting destroyed by the patient's own immune system. If type 1 diabetes was cured from the patient would not have to prick themselves and check their blood sugar levels, inject themselves with insulin, or watch what they need to eat for the rest of their lives. Rachel Bernstein, a reporter for the Los Angeles Times, wrote about a man who received a bone marrow transplant for his leukemia. The man was also HIV positive. After having the transplant, he no longer had leukemia or HIV. Bone marrow transplant aren't ideal because it can be difficult to find a matching donor and the treatment is risky. To get a bone marrow transplant, the patient has to go through a painful treatment and there is always the risk of infection and rejection. Curing HIV with stem cells has been tested on mice. Scientists have cured the mice by infecting them with the HIV virus and then treated them with the stem cells which cured them of the virus. Joseph Purita, an orthopedic surgeon, injected stem cells into Bartolo Colon, who was a Yankees baseball player, who was out for the season due to elbow and shoulder injuries. Pano said that stem cells can make replacements for cells that are lost through normal causes such as tear, injury, or disease. Stem cells were taken from Coleman's bone marrow and put into the shoulder and elbow where he had been previously injured. The bone marrow stem cells helped fix the ligaments of a torn rotator cuff. After being injected, he returned to playing and was good as ever. Robert Lanza, Chief Scientific Officer at Advanced Cell Technology, claims that embryonic stem cells returned the eyesight of two people who were slowly going blind. The experiment was originally intended to test the safety of stem cells injected into the eye. Both of the patients on which the stem cells were tested were legally blind. One patient noticed improvement in her vision within 6 weeks of having the cells injected into her eyes. Various tests have shown that new healthy cells have grown at the site at which the embryonic stem cells were injected for both patients. Embryonic stem cells do not necessarily need to be used, but they are the stem cells that are the most useful. They are useful due to the fact that they can turn into any type of stem cell. Having this ability can help everyone greatly. The embryos used for this research have usually been donated for the purpose of research. Other embryos that are used have also been frozen and left behind after in vitro fertilization. Embryonic stem cells should be used because they intentionally fix everything. According to Susan Lewis, a writer for PBS, only a single stem cell needs to be extracted to get the needed embryonic stem cells. This demonstrated that embryonic stem cells should be extracted without destroying the entire embryo. The embryo can be put into the freezer and be used later in reproduction. If this can be done, then embryonic stem cells can then be used to help people and the embryo